Hello everyone, my name is Carrie King and I have been a registered nurse for about the last 23 years. I've spent my career working in lots of different areas in healthcare. My couple favorite areas though that I've spent a lot of time in the hospital, my favorite area is the emergency department. Hands down, it's my favorite, and I really just consider myself an emergency room nurse at heart, and that's where I would go if I needed to go back to the hospital to work. And then I've also spent the last 13 years of my career working for a group of plastic surgeons here in the Salt Lake Valley. The surgeons I work for do a lot of different reconstruction work. They also help women with a lot of disfigurement and different issues that they're having. So we do a lot of cosmetic surgery, but then also a lot of other types of surgeries that are really empowering to women and men, and seen them make a big difference in people's lives. So that's a really rewarding experience. In that job, I spend a lot of time with patients, with patient education, and we also have a lot of autonomy when we are seeing patients when the doctors are in surgery and trying to be their eyes and ears, pick up on issues or problems, and kind of intercede when we can to prevent things from happening. As far as this course goes, I'm really excited to be able to focus on the community and have different things brought to my attention. And I think as nurses, we get really focused on our little area, our bubble of what our specialty is, and we don't often look outside of that. So I'm excited for this course to be eye-opening for me, to teach me different ways to be of use to my community, but also push me outside of my comfort zone a bit and help me reach out and do different things that I wouldn't normally do. So that will be a good experience for me. In reading this article and trying to think of different ways that healthcare can be turned around in the United States, I think the biggest things that stood out to me and probably to a lot of people were just that healthcare really needs to be, the focus needs to be on prevention and educating our patients. And by doing that, we alleviate a lot of financial burden on patients and stress in their lives. But we spend a lot of time educating patients and they still don't do it. So sometimes I think to be able to educate people and have them make changes in their lives, they also need to have trust in us. And to do that, we need to have transparency in our healthcare system, and having them know that there's not a motive behind what we're trying to teach them, helping the public to build trust in the science behind our medicine and the reasons why we want them to do things. And I think a lot of people think medicine is really more of a business than it is there to do them good. So by changing the way medicine is ran, instead of having it be such a business type of format, maybe we could get our patients to practice prevention and trust us in what we're saying. The biggest example I've seen of this is through the COVID pandemic. I remember watching a news story on TV, and they were interviewing some IMC nurses that were working on the COVID floor, and they were exhausted and they were burned out and just in tears begging people to wear their mask and isolate from people and stop spreading the disease because it was taking so many people's lives and having such a huge effect on people. But so many of the public still didn't believe that our own nurses, they didn't believe us when we were showing them and trying to tell them all the things that were happening. There was still so much pushback from the public. And I think that was a really eye-opening experience to me, to know that there needs to be some changes. And we as nurses really have to be some of those people going out and trying to make changes for them so they can see that we're trying to do this for them. And there's not a motivation behind it of money or healthcare ran as a business or something like that. So anyways, I'm excited to be able to learn from everybody and all the other different areas people have worked in, and other ideas and be brought to my attention. So it should be a good course. Thanks. Bye-bye.